The lymphatic system is difficult to demonstrate on any model because it's made of very small vessels that are present at almost every level of the body, paralleling almost every vessel. So along almost every artery and vein, we have deep lymphatic vessels. But in addition to that, we also have superficial lymphatic vessels shown here in the subcutaneous fat. And these are going to be draining to lymph nodes. Now, lymph nodes are located all over the body. They tend to be in clusters that are named for the nearby vessels, typically. But these lymph nodes screen the lymph and then pass it into new lymph vessels that are leaving them and go and join deeper lymph vessels. The lymphatic fluid from the lower limbs and the abdominal pelvic organs is going to pass through various lymph nodes along the aorta, inferior vena cava, and it's going to come to a lymph sac in this area called the cisterna chyli. Now, it's not illustrated in this model, but it's a sac that tends to receive the lymph from the abdominal pelvic organs, the lower limbs, and it's going to give off a single trunk that pierces the diaphragm, and that is called the thoracic duct. And the thoracic duct is basically the largest lymphatic vessel in the body, although that is faint praise because it's still not that large. But the thoracic duct is going to travel anterior to the thoracic vertebra, up towards the thoracic aperture superiorly, and it's going to pass posterior to the subclavian vessels and dump into the subclavian vein on the left side. So that's important. Thoracic duct drains to the left subclavian vein, and in addition to that, we have a subclavian lymph trunk from the left upper limb, a jugular lymph trunk from the left head and neck, and a bronchomediastinal trunk here on the left, draining part of the thoracic organs. So all that together tells us that about 3/4 to maybe 4/5 of the lymphatic fluid in the body is draining to that left subclavian vein. Now, as you scan over here to the right, it's very similar, except there's no thoracic duct. So all that we have here is a subclavian lymph trunk, a jugular lymph trunk, and a bronchomediastinal trunk draining to the right side. So there are lymphatic channels draining to this area, but they are not going to be as large as the ones on the left. It's to be noted that the lymph nodes in this area are the last lymph nodes that the lymph is going to encounter before it becomes part of the blood plasma. And enlargement of those lymph nodes can be a sign of cancer or other problems in the abdominal pelvic organs. Now, once the lymphatic fluid has reached the subclavian vein, it just enters it and becomes part of the blood plasma. To follow the flow of lymphatics through the body, we're going to start in the lower limb and look at the lymphatic vessels that are going to run parallel to the vessels that are located there, as well as some that are running in the superficial and deep space. So we have lymphatic vessels, deep lymphatics, running along every single one of these deep vessels. So right here we have the posterior tibial vein with lymphatics running along it. Those are deep lymphatics. We also have the fibular vein contributing to those, anterior tibial vein. So basically we have deep lymphatics running parallel to the big vascular structures in the body. Now, in addition to that, it's going to continue upward along that and follow the veins all the way up to the inguinal region here. Now, along the way, we're actually going to find that it's going to encounter superficial lymphatics that are going to follow those more superficial veins. So in this case, we have superficial tissues sending lymph to the small saphenous vein there, and those superficial lymph vessels are going to pierce into this popliteal fossa here and join the deep vessels there. And when that happens, it's very common to find lymph nodes at those areas where we transition between superficial and deep. In this case, we have popliteal lymph nodes located here in the popliteal fossa. And then up here in the inguinal region, we have superficial inguinal lymph nodes. So the lymph from the lower limbs is going to be screened by the popliteal and superficial inguinal nodes. And superficial inguinal nodes, it should be noted, are going to receive a lot of the lymph from below, but also from the superficial tissue that's being drained by the greater saphenous vein there. So that lymph traveling along that vessel and consolidating into vessels running parallel to it will get screened here at the superficial inguinal nodes and then continue following the vessels into the pelvis. So in the pelvis, we're going to start on the outside with our superficial inguinal lymph nodes, and then lymphatic fluid will travel in just past the inguinal ligament here, so where we have deep inguinal lymph nodes. And a lot of the time, these nodes are named for the nearby vessels, so we're going to have, thereafter, external iliac lymph nodes. Then we have internal iliac lymph nodes draining some of the lymph from the pelvic organs, and they're going to all send their lymphatic fluid towards common iliac lymph nodes located along the common iliac vein and artery there. We're then going to travel superiorly, and there are many lumbar lymph nodes here alongside the inferior vena cava, the aorta, and in between the two. So we can subdivide them into right, left, or intermediate groups. From here on out, we're just going to call these lumbar lymph nodes, but just be aware that further subdivision can happen. Moving into the abdomen, we're going to swap out the veins for the arteries, because a lot of the lymph nodes here are named for the vessels coming off the aorta, so the arteries supplying the gut. So once again, we have lots of lumbar lymph nodes running along the inferior vena cava and aorta. We have lymph vessels coming from the common iliac nodes, draining into those, and you can get a sense of just how chaotic this lymphatic flow can be. There's lots of alternative channels this fluid can take on its way superiorly. At the base of the inferior mesenteric artery, we have inferior mesenteric lymph nodes. They're going to receive the lymph from all the hindgut organs. Now, it's important to note there are other lymph nodes closer to these organs. We're not going to worry about them right now, but there are lymph nodes much closer to the organs themselves, but almost all of that lymph is going to flow down that vessel and get screened here at the inferior mesenteric lymph nodes. Likewise, midgut organs have lots of lymph nodes close to them, but they're going to consolidate their lymph vessels traveling down the superior mesenteric artery to reach superior mesenteric lymph nodes. And no big surprise, we have celiac lymph nodes draining the foregut organs. Now, one thing to remember here is once the lymph reaches this area, it just follows these vessels along the lumbar nodes superiorly. So lymph from the inferior mesenteric lymph nodes can make it to the superior mesenteric lymph nodes, and that lymph can thereafter raise up to the level of the celiac lymph nodes. Now, we'd expect, intuitively, for this to just keep on happening all the way up the aorta, but it doesn't. Instead, that lymph, along with lymph from the kidneys at hilar lymph nodes and the gonads going into the lumbar lymph nodes, a lot of it, in fact, most of it, is going to drain to a large lymphatic sac located here in the upper lumbar region or lower thoracic region occasionally. And this is the cisterna chyli, and it's receiving quite a lot of the lymph from the lower limbs and the abdominal pelvic organs. And that sac, receiving the lymphatic fluid, sends it up through the thorax via the thoracic duct. And the thoracic duct is going to take all that lymph up towards the left subclavian vein. So let's check that pathway out now. So the thoracic duct makes it to the left subclavian vein there, but in addition to that, we have lymph from the upper limb coming in as well. Now I want you to note that we've got the thoracic duct diving in here, and the last lymph nodes any of this lymph might get exposed to on the way in are going to be the left supraclavicular lymph nodes. Now those are going to be the lymph nodes that enlarge occasionally just before this fluid goes into the vein, and if that happens, it might mean that you've got trouble occurring somewhere in the abdominal pelvic region, possibly metastatic spread of cancer, causing enlargement of these left supraclavicular lymph nodes, also known as Virchow's nodes. All right, back to the limb, we can see that the deep lymphatics are still there. They're going to parallel the vessels that we studied in the lower limb. We also have superficial veins like the basilic and cephalic, so we're going to have superficial lymph vessels along there as well. And where the basilic vein joins the brachial vein, in that area we have cubital lymph nodes, also sometimes referred to, if they're very medial, as supratrochlear lymph nodes. But cubital lymph nodes here in the cubital fossa is what we'll go with right now. And once again, once that superficial lymph clears those nodes, it joins the deep lymph vessels traveling along the brachial vein upward. Likewise, cephalic vein here is going to drain not just the blood, but it's going to have lymphatic vessels running somewhat parallel to it, receiving superficial lymph. Those will often meet up with delta pectoral lymph nodes before diving in to join the deep lymphatic vessels along the axillary and then subclavian veins. And we have a very large cluster of lymph nodes in the armpit, otherwise known as the axilla, and these are the axillary lymph nodes. And these are a big deal And we may actually just have to spend another video on those at some point in the future. But just be aware they're subdivided into an anterior or pectoral group, a posterior or subscapular group, a lateral or humeral group, and then central and apical groups as well. So lymphatic fluid from the upper limb as well as some of the torso, the chest, is going to wind up in these axillary lymph nodes. Thereafter, it's going to work its way up to infraclavicular lymph nodes, supraclavicular lymph nodes, here shown on the right, and thereafter, that lymphatic fluid will drain into a right subclavian lymph trunk that drops into the subclavian vein, just as we'd expect from the same pattern on this side. Likewise, there's a left subclavian lymph trunk joining the thoracic duct or draining separately into the subclavian vein right near it. The head and neck lymphatics are going to be also involving parallels to the vessels. So running along the jugular set of veins here, we've got our external jugular vein here, anterior jugular vein here, and our internal jugular vein here, with superficial cervical lymph nodes on its lateral side there. Then we have a group of superior deep cervical lymph nodes and inferior deep cervical lymph nodes. And as the lymphatic fluid from the head and neck drains down, it's going to pass through these nodes. Now up here in the head, we have an area that's referred to as the pericervical lymph collar. So basically, lymph nodes scattered around in various places that are going to screen the lymph from the scalp and deeper structures. There are also some other named nodes that I'm not going to draw attention to now because we just want to get a sense of the overall flow of lymph. So these pericervical lymph nodes are going to drain their lymph primarily into the superficial and deep set of cervical lymph nodes. So we've got those there. We can just see those lymphatic vessels will gradually work their way into that system. And lymph has a great deal of variability, so we can't say for sure exactly what path that lymphatic fluid will take, but it will be tending to pass deeper and deeper into these superior deep and inferior deep cervical lymph nodes, at which point it's going to consolidate into a jugular lymph trunk that then drops into the right subclavian vein, or if we're on the left side, the left subclavian vein. Moving to the thorax, what we can see here is that along the internal thoracic veins, we've got peristernal lymph nodes. So peristernal, running right by the sternum there. They're going to be on both sides. And there's lymph trunks leading up from them, and they tend to drain to yet one more lymph trunk, the bronchomediastinal lymph trunk. But on the right, it goes to the right subclavian vein, and on the left, it goes to the left subclavian vein. So we're always trying to wind up in those places. If we're on the right, right subclavian vein. If we're on the left, left subclavian vein, along with everything draining from the thoracic duct. Along the trachea, we have an important group of nodes coming from the lungs. There are lymph nodes in the lungs and right at their hilum as well, but lymph from the lungs is going to be passing up the bronchi, and it'll encounter superior and inferior tracheobronchial lymph nodes, and further up it'll encounter paratracheal lymph nodes. So that lymphatic fluid, possibly containing metastatic tumor cells from the lungs, can pass up these bronchi. It will encounter the tracheobronchial lymph nodes and then drain superiorly through these paratracheal lymph nodes, and it can divert off and go through the bronchomediastinal trunk, or it continues superiorly in the paratracheal lymph nodes and actually encounter the deep inferior set of cervical lymph nodes. And at that point, either that lymph from the lungs can go through the bronchomediastinal trunk or the jugular trunk to reach the subclavian veins. Right there. So the take-home message is that on the left-hand side, we have lymph from the left upper limb, left head and neck, left thorax, and all the abdominal pelvic organs and lower limbs draining to this area. So a lot of lymphatic fluid to the left side. The right side also has an axillary, subclavian, jugular, and bronchomediastinal trunk, but no thoracic duct. So a lot less lymph going to the right side. Last, and certainly not least, we're going to talk about lymphatic drainage of the breast, because breast cancer can commonly spread through these nodes. It's important to know that the majority of the lymphatic fluid from the breast is going to drain towards the axillary lymph nodes. So here, the superior lateral, lateral, and inferior lateral side of the breast all tends to drain towards these axillary nodes, whereas it's only the more medial side of the breast that tends to drain towards the peristernal nodes. So we have different routes lymph can follow, and depending on the location of a breast lump or a carcinoma of the ducts of the breast, we might have spread in either of those directions. Now, once we get to the axillary nodes, that tumor cell or tumor cells can spread upwards through these nodes before reaching the subclavian lymph trunk, just as if we go medially, it can spread through these peristernal nodes to the bronchomediastinal trunk, and then potentially drop into circulation and become widely spread as metastases travel through the blood. So being able to follow the staging and spread of lymph and possibly tumor cells is an important consideration when we're looking at breast cancer.